Hello friends, Namaste from India. Welcome to this 36th session of Joie Rights to mark 28th May, that is today, which is globally observed as Menstrual Hygiene Day, as well as International Day of Action for Women's Health. As we all know, Menstrual Hygiene Day is a global awareness movement to highlight the importance of menstrual health, breaking period-related taboos, and ensuring access to safe products and sanitation facilities for women and girls by working together for a period-friendly world. That is the theme of this day. International Day of Action for Women's Health is a global campaign advocating for women's reproductive rights, addressing healthcare disparities, and promoting sexual health. Our special gratitude to WGNRR, that is Women's Global Network for Reproductive Rights, and to Joie Cortina for all support for this session. Friends, Joie Rights is dedicated to advancing gender equality and human right to health, both of which are fundamental human rights that are indivisible, inalienable, and inseparable. Joie Rights is together hosted by CNS and Global Center for Health Diplomacy and Inclusion, or SEDI, and partners, which include International Planned Parenthood Federation, or IPPF, Asian Pacific Resource and Research Center for Women, ARROW, and Asia Pacific Media Alliance for Health, Gender and Development Justice, or APCAT Media. Today's Joie Rights session is on the theme of navigating the bleeding edge, period poverty, and reproductive health in the polycrisis. Also, earlier this month, as many of us must be knowing, the International PCOS Network, in collaboration with the Lancet, officially renamed Polycystic Ovary Syndrome, that is PCOS, to Polyendocrine Metabolic Ovarian Syndrome, or PMOS. We need to democratize knowledge by translating this medical shift from PCOS to PMOS into accessible community-level health literacy. But why this change in name matters? Well, the old polycystic ovary syndrome was considered a misnomer for many reasons. The term polycystic suggests multiple abnormal cysts, which are typically fluid-filled sacs and could be normal structures in the ovary. Thus, the term overemphasizes ovaries and underplays the broader metabolic condition. The new name, Polyendocrine Metabolic Ovarian Syndrome, or PMOS, shifts the medical understanding of the condition from a simple ovarian cyst or isolated fertility issue to a whole body metabolic and hormonal disorder. This condition, PMOS, is not limited to the ovaries, but impacts multiple endocrine systems. It can affect the reproductive system, the metabolic health, dermatological health like skin and excessive male pattern hair growth on the face, chest and back, and mental health as well. The condition occurs when the ovaries produce excess androgens, which are the male hormones, causing hormonal imbalances that can lead to irregular periods, ovarian cysts, infertility, and metabolic issues. We have received several questions around PMOS, genital TB, and infertility. Responding to these questions, I would like to point out that while both genital tuberculosis and PMOS are leading causes of female infertility and menstrual irregularities, they are two very different and distinct conditions. Genital TB is a bacterial infection, whereas PMOS is a whole body, metabolic, and hormonal disorder. Despite distinct underlying causes, the two conditions can coexist and can be easily confused because they share some major overlaps. For example, both conditions are prominent causes of infertility, Both can cause irregular, missed, very heavy, or completely absent periods. Hence, the coexistence of genital TB with PMOS can lead to a delay in diagnosis and compound the new challenges in treatment of infertility. While we learn more about PMOS from our panelists today, let me add here that breaking the chain of TB infection transmission is essential if we are to prevent and end all forms of TB, including genital TB. Early and accurate diagnosis of genital TB is critically important, along with linkage to standard treatment, care, and support. Healthcare workers, including doctors, should also think of genital TB when dealing with infertility cases to rule out diagnostic and treatment delays. Today's session will also try to expose structural obstacles by highlighting how macroeconomic issues like inflation, climate change, etc., manifest directly on the bodies of menstruating individuals. Today, we will aim to build inter-regional solidarity by connecting grassroots organizers to share local strategies for combating period poverty without relying on erratic corporate or state funding. Achieving a period-friendly world is becoming radically more complicated today in this anti-rights and anti-gender era. We are living through a polycrisis, a time defined by the simultaneous and overlapping pressures of runaway inflation, climate-induced disasters, conflicts, supply chain disruptions, public health emergencies, and systemic poverty, alongside deep-rooted cultural stigmas and biases. Menstruation or period is a natural process, yet 500 million people globally experience period poverty every month and are unable to afford menstrual products or access water and sanitation facilities to manage their menstrual health and hygiene. The polycrisis has shifted menstrual hygiene from a basic healthcare right to an impossible financial trade-off. Families are increasingly forced to prioritize food and fuel over sanitary products. This session aims to strip away the clinical, top-down, academic jargon and center the conversation where the real battle against period poverty is fought, that is on the ground, led by community advocates and grassroots leaders and menstruators themselves in their entire diversity. Today, we will have an engaging panel discussion with ample time and space to listen and interact with all of you as well, as far as time permits. A few quick housekeeping announcements before we begin ASAP. Participants, please type in your questions in the chat box, even as the panelists speak. Your questions and reflections will be taken up at the end of the discussion. Also, please keep yourself muted throughout the panel discussion. We have a formidable array of panelists today, and our panel of speakers includes Joie Cortina, Menstrual Health and Dignity Advocate, Sang for Sang Program Officer, Women's Global Network for Reproductive Rights from Philippines. Radha Paudel, activist and a lifelong rebel for Dignified Menstruation, founder of Global South Coalition for Dignified Menstruation, and founder-director of Radha Paudel Foundation from Nepal. Rita Vidyadana, a long-time gender and health justice advocate, former editor at the Jakarta Post, and currently country director of Consortium for Press Freedom. Rita is also board member of Asia Pacific Media Alliance for Health, Gender and Development Justice, that is APCAT Media, and co-chair of She and Rights Media Awards. Rita is from Indonesia. And we have Angel Babriye, President, African Youth and Adolescent Network, East and Southern Africa, and Chief Executive Officer of Us for Girls Foundation, Uganda. So let's begin without any further ado. So my first question to the panelists is, how do macro level issues like inflation, climate change, and others which you may name manifest directly on the bodies of menstruating persons? And how can we move away from merely treat and run pad distributions towards building climate and disaster resilient, period friendly responses? Radha ji, would you begin? We cannot hear you. Are you muted? No, we can't hear you. No. No. Bobby, can you help? Is there a problem at our end or Radha ji's end?
Yeah, I think she's trying to reconnect with her mobile, so maybe you can move ahead with the other panelists.
All right, all right, all right. Is Angel there? Has Angel come? Or Rita, can we? Yes.
Not yet.
Okay. Rita, can you begin, please? Rita Vidyadan.
Good evening, everybody. Thank you, Soba, for having me here in this very important discussion. Greetings for all distinguished panelists and participants. Yes, in Indonesia, actually, the period poverty is driven mostly by financial constraint and inadequate infrastructures. The climate change and climate crisis and inflation really affects women and girls in Indonesia, especially during their menstruation period. Indonesia is located in a ring of fire territory. The climate crisis worsened the suffers of poor Indonesia during menstruation. Women and girls lost their safe spaces. They lost access to clean water and human dignity while facing increasing health risks. Indonesia is experienced like flooding, earthquake, conflicts where women and girls suffer in evacuation centers. So when this is a global inflation really affect Indonesian girls and women, especially those living in rural areas. In Indonesia, the majority of girls and they are living in low-income households where sanitary pads is a luxury. When inflation comes, it means that the price of sanitary pads are increasing. In Indonesia, sanitary pads are luxury for those living in rural areas. It also subject to 11% value added tax. So when inflation comes, nobody can afford sanitary pads. And these women, us and girls, are suffering most during the inflation. So I think both climate crisis and inflation really affect the body of all menstruating girls and women in Indonesia because they cannot afford clean water, they cannot afford sanitary pads. That's how we try to combat poverty period in Indonesia. Soba, over to you.
All right. Radha ji,
Yes.
yes,
Do you hear me?
yes, we can hear you very clearly now.
Okay.
Thank you.
Thank you so much. I use the mobile.
Yes.
Mm, Before talking about the impact of the climate change or any other macro issues
Yes.
on the health of menstruators or
Yes.
body of the menstruators,
Yes.
I asked everyone to redefine or challenge conventional definition of menstrual discrimination. Menstrual discrimination is widespread globally with the over 5,000 euphemism and various forms. The most importantly, menstrual discrimination play a vital role on construction of the unequal power relation, patriarchy, and exclusion. This is the departure point while we talk about the climate justice or menstrual product or any kind of rights for menstruators. In this connection, beyond the distribution of the menstrual pad or tax or accessibility, we need to think that where are the mensurators in a is a human being. Most of the policies from even to the village level policies, they often missed counting the mensurators in all diversities. The most of the conventional forms or format of assessment only discuss about male and female, and we have to think and fight to get the attention for the menstruators with disability, LGBTQI communities. So the first, the population itself ignored. The second, the policy gaps. Where are the mensurators in policy making? Where is the budget for addressing needs and priorities of the mensurators from all diversities? And where is the budget? Who are in the research team? That kind of things are missing. And additionally, the symptomatically, the supply chain is affected because of the climate induced disasters and in other conditions. That is why the distribution of the menstrual pad, I repeat here, menstrual pad, I am not saying sanitary pad because our blood is clean blood, pure blood. That is why I love to use the word of the menstrual pad or menstrual product instead of the sanitary pad. Distribution of the free menstrual pad or product is absolutely is dehumanized and colonize mindset. The entire process of the planning process or stage of the climate justice or inflation, uh, they miss out the needs and priorities of the mensurators. If we really like to ensure their dignity or dignified menstruation, while I use the dignity over here, menstrual dignity over here, it's not only the right to dignity. It is a composite outcome of the right to dignity, right to freedom, right to equality, and right to non-discrimination. Whether this menstrual dignity is putting into the center of the entire planning process. Whether we
We have lost you again. Radhaji, we have lost you again. Okay, we will come back to Radhaji once I think her connectivity problem is solved. Joie, can we move on to you?
Yes, of course. Thank you
Yes.
for inviting me here. This is the first time that I am taking part of these sessions with CNS and our colleagues. So, and this is a really, I'm thrilled to be in the company of such impassioned advocates. So I will try to veer away from the very technical and advocacy jargon, but really centered on the lived experiences of menstruating persons. So here in the Philippines, the summer months like now are typically like times that fires are really rampant. And I'll just give you an example. Over the weekend, in a an informal settlement in Manila, a fire broke out. There were 200 families affected, and the firefighters really had a challenge putting out the fire because also of the drought. And when we were asking the community members what they need uh, for the displaced families, one item they mentioned is underwear. And I can imagine if you're a person who is menstruating, you lost everything that you have in a fire. Of course, you will. The first things that you will look for is something that will, have you uphold your dignity somehow, like something very basic as underwear. So these things really affect the menstruators in a very visceral way. Like beyond the, we don't need uh, a really thorough analysis of it, but looking at the, just coming from a place of empathy, you have a um, menstruator from a resource poor background already having um, unable to afford commodities, food, medicines, and now because of a crisis like uh, the overarching climate crisis, which causes intense heat in Manila, in the Philippines, and also a rise on crisis will affect them in the foreseeable future. So this really affects their bodies, their well-being, and their ability to make decisions about their bodies, to advocate for themselves, to demand for things like commodities, essential commodities, and including period commodities. So it affects the bodies of individuals and also their well-being and their confidence to assert themselves, to really demand for their access to health and their, of course, their rights. So those are my initial thoughts.
Okay. Thank you. Radha ji, are you back again? So you may
Yes, yes,
Yes,
yes.
yes, please. We lost you. Yes. So please continue. Sorry for
Yeah,
that interruption. Yes.
extremely sorry. I'm right now. I'm in the mountain region, one of the very
Yes.
remote part of the
Right.
country,
Yes,
for the
yes.
series of training workshop on dignified menstruation. And
Okay.
sorry for
Yes, yes.
that. Actually, I'm trying to say that most of the times when we talk about the menstrual health or women's health, we always focus on the symptomatically. We focus on the only the 5 days of the bleeding. Actually, the menstrual discrimination impact throughout the life cycle from home to tomb, and in many cultures all around the globe, even after the death there is a discrimination. And if we are really looking for the uplifting of the menstruators, or empowering them, or building their agencies, we have to put the menstrual dignity in our all project cycle. And if we are preparing the team by incorporating the mensurators in a policy meeting or decision making or research team, it is easier to address their needs and priorities by putting the programs, allocating the budget, and ensuring the programs in all corners of the world where the menstruators are there. Let me give example from the COVID-19 pandemic. During that pandemic, there is no consideration of menstruators. That is why the frontliner workers of the COVID pandemic, they were used contraceptives to end or stop the menstruation. And during COVID pandemic, over 70% of the frontliner workers were women, mostly the menstruators. So that is why we need to put the menstrual dignity into the center since beginning of the project cycle before starting any climate disaster or pandemics or any macro issues like inflation or anything else. Let me pause here and I will come back again.
Okay, thank you. Now, what does menstrual dignity, and Radha ji has talked of that term, what does it actually look like in evacuation centers or temporary makeshift camps when there is no privacy, running water, or safe disposal systems? Any of the panelists can please delve on that.
Let me go first
Yes,
because
yes,
I'm worried
please.
about the internet.
Yes, please.
Some extent, I have already respond this question as well, because we don't predict the climate crisis or evacuation, but we are prepared. We means the government, the NGOs, the stakeholders are prepared for that, and it has to go through the planning stage. And if we prepared the go back means the essential materials and equipments like medicine, like a menstrual product, even the soap which we can use in a very limited water. So if we able to prepare the go back type of things during the preparation phase, if we are able to educate the people who are in the risks or vulnerable for that kind of situations, if we are educate the policymakers, if we are include the mensurators from different setting into the planning process or research or decision making, we can minimize the undignified situation while working in evacuating situations where there is no privacy or running water or something like that. When we talk about the menstrual dignity, usually most of the stakeholders very loosely use the word of the dignity. As I shared earlier, while we use the Global South Coalition for Dignified Menstruation, while using the menstrual dignity, it has a broader meaning. It has a right to dignity, right to freedom, right to equality, and right to non-discrimination. Each mensurators, no matter whether they are in the evacuation camp or refugee camp or camps of the war-affected population or any climate or man-made disasters, we need to we need to prioritize the needs and priorities of the mensurators. I pause here.
Okay, thank you. Joy, what is the situation like from the Philippines perspective?
Yeah, I'm glad you asked that because prior to my current role in menstrual health and dignity, I was part of organizations that respond to the needs of communities in emergencies. And in our experience, when it comes to preparing the dignity packs that will be distributed to families, it's there is a bit of a resistance. There's struggle to convince the responding organizations, those who procure what will be in the dignity packs. It's always there's a bit of resistance for them to include um for them to include sanitary pads or even underwear. So that's the situation because again, it reverts to the idea that these commodities, these effects are not essential. That food, that water must be prioritized. So again, it's coming from the idea these are luxury products, and that really affects the sense of dignity of menstruating individuals in crisis. I had a conversation with a young leader from uh, a village in the northern part of the Philippines, they use rags that are very unsanitary for their to catch menstrual blood, and this is not acceptable. But again, we have to recognize that this is not up to these are not up to standards. But you have to honor the resourcefulness, the ways that the menstruators, women and girls, assert their dignity even in such challenging situations.
Thank you. Rita, would you like to add something to it?
Yes, I agree with Joy. And Indonesia is like similar situation with the Philippines in natural conditions and people living in poverty-stricken areas as and also natural disaster prone area. So I think mostly when it comes to menstrual products, those relief efforts frequently neglected the needs of menstruating girls and women in that difficult situation, because they always think that food, waters, and medicines are the priority, while menstrual products are considered uh, unimportant uh, things to provide when it comes to women and girls living in evacuation or some displaced areas. So I think we need to encourage any government agency or NGO, local communities to provide those women and girls uh, who are suffering in those evacuation centers, to provide them with adequate menstrual products, clean water, so they really feel safe when they experience menstrual periods. So I think they need to add more attention to menstrual products in addition to food, water, and other necessities. I think similar to Joy experience there.
Okay. Thank you. I welcome Angel Bavrier. Now we will get the African perspective on today's discussion. Welcome, Angel. And can you please delve upon how do micro level issues like inflation, climate change, etc., manifest on the bodies of menstruating persons? And how can we move away from the merely treat and run pad distributions towards building climate and disaster resilient, period friendly responses? Over to you, Angel.
Yes, can you hear me clearly?
Yes, very clear.
Okay, great. Hello everyone. My name is Angel Babidie from Uganda. I am the team lead of a grassroots organization called Us for Girls, and here we address menstrual health challenges faced by adolescent girls and young women. Yes, thank you so much for that question around how inflation or even climate change can manifest directly on the bodies of people who are menstruating. I think one of the ways that usually when you talk about these things, they sound very abstract, and yet when they're actually being experienced, they're experienced physically by menstruating persons. And one of the things that we've actually seen, I think, even with the recent wars, for example, all across the world, we've seen that inflation has ended up affecting so many countries, not only in Africa but also all across the world, and this has actually affected, first of all, the prices of menstrual products. We've seen that they've been hiked, especially looking at contexts where they've always been considered luxury items, but they actually haven't only stopped there. It is also affected for example, access to pain medication, because we know that usually when the cost of living rises, menstrual health then is often deprioritized, especially because, just like past speakers have really said, it is considered either secondary or optional or even luxurious. but also looking at many of the homes within our context. Very many of them, for starters, really cannot afford them. Very many families are usually stuck between, do we buy food for, the household, or do we use that? Almost in Uganda, for example, it's almost $1. Do we use that money to instead buy a pad and for this girl? And you'll find that in very many of our communities, these families do not only have that one girl as as the only person who's menstruating. So it's the price then becomes compounded. So you'll find that very many girls and women end up using stretching products, stretching these products beyond safe use. And if a pad, for example, is saying you should use it between 6 to 8 hours, you find one using it for longer hours or even spending the whole day in it. Why? Because products are actually expensive due to inflation and all. And this, as we all know, has increased the susceptibility of these young girls to infectious um sorry, to reproductive tract infections. For example, we know what happens with the tampons around toxic shock syndrome. So those are some of the ways. But then also girls then end up resorting to unsafe alternatives. The previous speaker was talking about how girls have ended up being forced to resort to, for example, using rags. But I've met girls in Uganda who are forced to, for example, use socks, to use dried dung. And these honestly end up increasing their susceptibility to reproductive tract infections. Yes, it's quite sad, but in other cases we've actually seen that because these girls are not able to afford these materials, they are then forced to, for example, engage in transactional sex with men, with older men who could have more, who could have money and are telling them, "Oh, I'll actually give you the pads that you need," and things of a sort. It is not something that is coming up willingly. It is something that these girls are actually forced to do. And that, of course, also increases the risk to HIV, to STIs, and even to teenage pregnancies. So those are some of the challenges that I've seen happen. But sometimes it actually also goes beyond that. Girls will be forced to miss school or work entirely just because they actually cannot access these products that are not affordable. So those are one of the ways that inflation ends up affecting or at least manifesting directly on the bodies of these menstruating persons. And it really is broad from particularly around the affordability of these menstrual products. And then um, when it comes to climate change, there is of course the problems that we've seen floods and droughts, and these actually have led to displacement. But then also most of the products that we've been giving these girls, for example, you'll find that most organizations who are carrying out these outreaches provide reusable pads. And sometimes with cases, for example, of drought, you find that the water access is actually affected. So these girls will might lack access to clean water to not only clean these reusable pads, but to also clean their bodies. And that also opens them up to, a whole load of reproductive tract infections. And not only that, there is also cases where we've seen, of course, that this whole things around the floods and the droughts themselves can also, at a broader level, really disrupt the supply chains, particularly for menstrual products. And when we're particularly looking at humanitarian crisis, then it also ends up interrupting maybe the continuity of care, particularly from girls who are having issues when it comes to menstrual diseases and disorders. So those are at least some of the ways that I've really seen these things manifest in my community. Thank you, and over to you.
Yes, Angel, I would like to continue a little bit more. That how can we move away from this treat and run pad distribution and build climate and disaster resilient period friendly responses? Any suggestions on that?
I beg your pardon?
How can we build climate and disaster resilient period friendly responses and just move away from just merely treat and run pad distributions?
Okay. Thank you so much. I think that's actually a very great question and also a great opportunity for us to see how we then move away from these short-term approaches, be it in humanitarian settings or even just in communities. And I think it's very important for us to also acknowledge the fact that emergency pads like these distributions are important. because believe me, I've actually seen the impacts that they actually help these girls with. You know, you're helping this girl who's been using an unsafe menstrual product. You're now equipping her with, for example, a pad. But can we also see that these emergency pads, for example, they are important, but they are insufficient when they're done in isolation. And for me, I do believe that we need to make sure that we now look at equipping communities or even countries to see how we can push for that local production of reusable and sustainable menstrual products. When we start, for example, importing some of these products, there's so many taxes that actually come into play. Very many countries have been advocating for free period products, but then also for taxes. For example, around the zero-rated tax, also the VAT to be removed. But it's still something that then ends up affecting, for example, local manufacturers when they are importing these products. Sometimes they're quite expensive, and that ends up incurring a higher cost on the end product user. So I believe one of the things that we can actively push for could be to see how we now have that community ownership or at least local production of these reusable and sustainable products. But I also believe we need to look at menstrual health in a comprehensive way and realize that periods do not stop for war. They do not stop for humanitarian crisis. They range all the way from menarche to menopause. They affect a woman's life, and to look at that and incorporate it meaningfully in our planning to say that how do we then integrate menstrual health, for example, into disaster preparedness plans? Because just like past speakers have been talking about, it usually comes as an afterthought. And yet, for the longest time, at least now we know that menstrual health is not only just about the pads. It is also about, do you have access to, for example, clean water, access to private facilities, and all these things. So to see how we can actually incorporate that into those disaster preparedness plans, and to also see how I believe one of the other things would be promoting this menstrual literacy and in communities, so that people can know that when you talk about menstruation, it is still not just about the pads. And this is something that ranges all the way from menarche to menopause, right? And to see how it then manifests differently across these different stages, so that women can get the care that they need and the support that they need, but then also so that we can demystify some stages of it. For example, menopause sometimes is used as a slang in some cases, and I'm like, no, that's a normal menstrual process. So we need to also promote that menstrual literacy so that people can know exactly what women go through, and in that way also provide the adequate support that they need. Provide the adequate support that they need. And I believe even as we are promoting this menstrual literacy, it shouldn't be done in a silo and say we're going to have this only for the girls, but to make it an inclusive community concern, to see how to bring the men and boys into these conversations, so that it's not a one-off thing where we say, okay, we've donated these pads to only the girls. The brothers need to know that their sisters menstruate. The men need to know that women menstruate. And when they do menstruate, everyone menstruates differently. Yes, today they need pads so that even when they are planning for their families, they can at least put that small allocation and so that this will actually cater for the pads that these girls will need. If she has pain, to believe her. If they have pain, to actually believe that this period pain, it is valid and it is real and they experience it. And maybe they should actually also take them to the hospital if it's disrupting their daily activities or even how they participate in community. So for me, I really believe menstrual literacy will be very, very important, but in a way that doesn't just center it as pads, or even that doesn't just center it as just menstruation, but to look at the whole process holistically from menarche to menopause, and to look beyond the pads and incorporate wash infrastructure, privacy facilities, pain management, and the diseases and disorders related to menstruation. Yes, thank you so much. And over to you.
Yeah, thank you, Angel. And very rightly said about menstrual literacy, because like even I come from India, even in India, even today, even in urban areas, I see that there are so many myths and misconceptions surrounding menstruation. A woman is not supposed to visit a religious place or take part in religious functions. And I'm talking of educated families. And when I ask them, why do you believe in that? They say, well, that has been the norm. So we are just following it. So that is again one part of breaking down these misconceptions that there is nothing impure about menstruation. Perhaps in fact, it's a sign of good health if you are menstruating properly. So menstrual literacy is very important. We are really having a nice, vibrant discussion. Now, I would like our panelists to please suggest what localized, low-cost community health strategies in their minds can prevent menstruators in crisis from falling through the cracks of a disrupted healthcare system. What are the localized, low-cost community health strategies which you can suggest? Radha ji, can we begin from you?
Yeah, thank you.
Yes.
Again, I place to everyone to acknowledge the complex and multifaceted nature of the menstrual discrimination. It is not the single event or act. It is a ranges of perception and practices, includes silence, taboo, stigma, restriction, abuses, violences, and deprivation from resources and services throughout the life cycle of menstruators in all diversities. This is very, very important. Once we acknowledge the complexity of the menstrual discrimination, we need to mainstream the dignified menstruation or menstrual talk dignity first. This is the mantra, this is the formula for us. Till now, from even to the local level, while we talk about the gender equality and social inclusion policy, recently gender equality, disability and social inclusion policy doesn't address the discrimination related with the menstruation and menopause. That is why we need to revise or mainstream the dignified menstruation. Likewise, there are many countries have a sexual SRHR policies and programs. Even it is guaranteed in their constitution. But there is a huge gap in understanding that menstrual dignity or dignified menstruation is an entry point for the SRHR. Without having a bodily autonomy or without practicing dignified menstruation at an individual as a family level, how could the menstruators say no for the child marriage or say no for the unsafe sex or can seek the safe abortion clinic or etc. So all SRHR policies and programs have to incorporate the dignified menstruation where we can dismantle the patriarchy, improving the inclusion and bring or cultivate the culture of equality. Likewise, based on the experience of Global South Coalition for Dignified Menstruation, in last 10 years, we have done the exercises over 15,000 participants from all around the globe, and they learned something about menstrual discrimination between the age of 6 to 9 years. But we always talk about the menarche, but before the menarche, like around 6 to 7 years, depending on the culture and the geographies, before the menarche, minimum 6 years, they learned the menstrual discrimination. The menstruators started to consider themselves as inferior, powerless, vulnerable, whereas non-menstruators consider themselves as a pure, powerful, superior. And this is how the patriarchy, unequal power relation and exclusion takes place at home. And our education system, our means from global north to global south, doesn't talk about the facts about the menstruation or message around dignified menstruation. If we really like to bring the local strategies, we need to incorporate the dignified menstruation from the grade 1 to the university's level of education. Even today in US, in UK, there is no session around menstrual discrimination or discrimination related with the menopause in their universities, even in the medical or nursing universities. Recently, the UK government started to provide that kind of knowledge through the in-service education. That is why we need to seriously incorporate the dignified menstruation in all health education, information, behavioral change, communication. And likewise, while we engage the communities, we need to engage with the non-mensurators, because non-mensurators still doesn't acknowledge that they are born from the menstrual blood. If we are really looking for the responsible non-mensurators, if we are really looking for the non-mensurators holding the accountability to protest or promote the dignified menstruation, we need to engage them since the age of 6, where they can take the accountability, and at the meantime, the mensurators who are socialized along with them, they socialize that they have the uterus, they will menstruate, and this is their power. So the fundamental, the things, the basic things we are missing in health education or in general education system. And while engaging in the communities, we need to engage with the faith healers, religious leaders. We don't tell very openly, which is open secret. Since the time of Homo sapiens, the menstruation is exists, and because of that menstruation, this world is moving forward. Everything is possible. But we never tell that the menstruation is there in this universe before emergence of any religion, before emergence of any philosopher, before emergence of the Marx or Lenin. That kind of things we never discuss. So we need to engage with the faith healers without any resistance, without any hesitation. We need to engage with the mothers group, the political leaders, political parties, and of course the state. Ultimately, the state is responsible, and globally, most of the governments are signatory for the different kind of human rights instruments. And if we take example of the International Human Rights Declaration in 1948, it is already over 76 years, and there is no any campaign that menstrual discrimination is a violation of the human rights. That kind of things we need to roll out from even to the local level. And likewise, the CEDAW. CEDAW is a first international human rights instrument for the women's rights. And we talk a lot about the gender stereotypes, and we don't talk about the menstruation and menstrual discrimination. We're just preaching in the different names and forms, but we are not really challenging our attitude, our thoughts, and then we are not really taking the small action. We don't need the project, we don't need the big funding, but we need a mindset. We need to acknowledge that this universe is possible because of the menstruation, and that is natural, and that should be dignified without any condition. That's all right now.
Thank you, Radhaji. We are all power to you. Yes, Joey, what are your thoughts on localized,
Yes,
low-cost Yes.
absolutely. There's a lot of discussion on that as well. We do acknowledge that sometimes local traditional knowledge can come in tensions, can have tensions with like proven modern health interventions. I just remember a conversation I had with an indigenous community leader a year ago or so. They said that they pass on knowledge about the use of herbs in alleviating menstrual symptoms. And, we have mixed ideas, insights about traditional medicine, but we also, as feminists, we do respect the bodily autonomy and self-determination of individuals if on how they choose to fulfill their health needs, their needs for relief. And there's that acknowledging those health practices, and also this advocate, this community leader from the indigenous communities also said that the plant species that they use to make herbal teas to alleviate menstrual symptoms, they are becoming harder and harder to come by. because of habitat loss due to climate crisis and also extractivism because they live in communities where there's mining, there's deforestation. So you can see there's already community interventions, knowledge in traditional knowledge that's passed on and sustained in communities, low cost even. It's just that it is also under threat because of the climate crisis and also the crisis of extractivism. So I think we can appreciate the interlocking nature of menstrual health and dignity, along with other sexual and reproductive health and rights, teens and issues, bodily autonomy issues, and also social development issues. So
Okay.
those are my thoughts at the moment.
Thank you. Rita?
Thank you, Soba.
Mm.
So I do agree with Angel, with Joy, and Dr. Radha. But also in Indonesia, I'm very glad that many grassroots organizations, social enterprises implementing like a very simple but effective strategy in alleviating menstruation problem here in their community with simple language and simple activity that is understandable to local community because local community do not understand human rights, do not understand policy, but they interfere with very practical daily basis. I put an example. There is an organization, Perfect Fits, social enterprise working in East Nusa Tenggara province, Sulawesi, which is very poor there. Uh, they address both period poverty and also environmental sustainability by teaching women there producing leak-proof, reusable menstrual pads and underwear, while also driving educational campaigns to religious leaders, community leaders, traditional on how they should change the narrative of menstruation in their communities. So it's like a simple and practical ways. And also of many student-led organizations in Jakarta and other city in Indonesia, they began to raise awareness among girls, among students, and donate sustainable organic cotton and educate their peers about menstruation. So this is a kind of localized, practical, and also Biung Indonesia. Biung is means mothers Indonesia. They provide training and teaching girls and women in underprivileged community to safely create and clean reusable menstrual products. So I think in addition to our effort to make this menstruation a national discourse, but we need also some organization that directly work with local and provide effective and practical solution to their problems. Over to you, Selba.
Thank you. Thank you, Rita. Now, let us talk a little bit about this global shift from PCOS to PMOS. And how can we use this global shift to dismantle the cultural stigma surrounding irregular periods and shift our focus towards metabolic health, nutrition, and mental well-being rather than just reproductive capabilities of women? Joey, would you like to dismantle this?
Yes, I'm happily.
Yes,
This is
thank
a
you.
happy task. We
Yes,
dismantle this along with our dismantling of the patriarchy. But
yes, yes.
yeah, just to reflect on this, my background is also on feminist research, and we know that historically, the lived experiences of women, especially in the so-called hard sciences, have always been relegated to the sidelines, like the symptoms, the experiences of pleasure, the experiences of pain by women and girls, by female assigned bodies, have always been relegated to the sidelines, invisibilized in so many discourses. And this shift from calling it PCOS to PMOS is reflective of, listening, like providing menstruators with a bit of epistemic privilege. So they are really informing the interventions. Their actual experiencing are informing health interventions. And this is a most welcome shift. So it means that with this understanding that this is not just a gynecological gynecological issue, then the response will be again beyond the give a pad and go, like understanding that nutrition affects the experience of PMOS will also give advocates like this knowledge of really asserting for a more holistic approach to health, like not just giving pads and commodities, but ensuring access to nutrition, access to food that would not result in hormonal imbalances. So I think this is a very welcome development, and even those uh, that are not part of the medical community, the actual persons experiencing PMOS themselves most welcome this.
Thank you. Would any of the other panelists like to add something to this?
Yes, let me go.
Yes, please.
Thank you so much. I do agree with the Joy actually. In addition to, while we talk about the PMOS or global setting, we need to see through the perspective of the three areas. The first, menstruation. Menstruation, we need to see from the perspective of the biology. And it's not only the biology, it is also the construction of the sociology and the psychology. And today, most of the UN INGOs are advocating for the restrooms in the schools and menstrual leave, which is not really recognizing the gravity of health conditions which is associated with the menstruation, like PMOS. Even the mild type of premenstrual symptoms or pain glorified, and then the misinterpretation mislead the moment. And at the meantime, the situation like PMOS are making a sideline, and then the menstruators are not getting attention. In PMS, it's not like the mild or moderate type of PMS. It is a special case. It needs the thorough investigation, blood test, hormonal test, MRI, CT scan, which is not possible through the simple health insurance package. The state has to take the responsibility. It doesn't ensure through the popular agenda like menstrual leave, announcing menstrual leave, or distribution of the premenstrual product, or construction of the restrooms in the schools. So while we talk about the PMS, we need to also discuss about the menstrual discrimination. Whether before having any kind of or confirming any kind of condition, we need to see through the departure point of the menstrual discrimination. When and how that individual know the menstrual discrimination and construct the power relation, unequal power relation, patriarchy and exclusion. If we consider the each menstruators as a human being, equal human being, and because of the uterus or menstruation, that person has additional rights like maternal leave or vaccination or family planning, contraceptives, that kind of things. We easily respect the people or menstruators who have a PMS. So that is why we need a decolonized lens to talk about the PMOS. And then dignified menstruation, the third formula is dignified menstruation. If you are talking something related with the menstruation, we need to put the menstrual talk dignity first. No matter whether it is a PMS or the menstrual product or reusable pad or tampon or education or health, if you put the menstrual dignity at center, you can address so many political, social, cultural, economical, technical issues at once. That is why we need to shift our mindsets, and we need to commit it. We need to be ready to address the decolonized framework that is dignified menstruation. Thank you.
Thank you very much. Rita, any thoughts from your end?
Yeah, I think this is very interesting that menstruation is linked to mental health well-being, which is never been, rarely been discourse. And also, like Dr. Radha said, it links to various factors. So many people, see that like women who are menstruators are, when they experience a health problem, they just, oh, it's just PMS, it's just menstruation, it's just undermined. Even all in companies, women cannot take their leave because everybody undermines the problems of menstruators, whether it's physical, mental, and psychological and biological conditions. So this is, I think this is very encouraging shift. And we agreed that we have to see this problems issue holistically. I think so.
Thank you. Thank you to all our panelists. And we are now open for reflections and questions from the audience. If anyone from the audience wants to share his or her thoughts, please raise your hand and unmute yourself, and then you can speak. Any one of you. We have got a few comments in the chat box. If you would really like to articulate those comments yourself, please raise your hands. Meanwhile, we had a question from Humphrey Porto from Liberia. And Humphrey says that many women in Liberia do not have easy access to clean water, and pads are costly that they cannot afford. And so they use old cloths during menstruation. How can we support such a population going through this going through this unhygienic practice? Would any of the, I think this issue has been discussed, but if any of the panelists would like to answer. Yes. Okay, I see Dr. Rajesh Sood has raised his hands. Welcome, Dr. Sood. And Dr. Sood is TB officer from Kangra in India, from Himachal Pradesh. Yes, sir.
I would like to share a small innovation that we have tried this year.
Yes.
We are doing a workshop with nursing colleges. So nursing colleges will be providing us we are doing an interactive workshop with the nursing colleges, and the youth will be making reels and posters and various innovative ways to discuss about this taboos and myths, so that through community nursing they can reach out to the community.
Right. You are doing many innovations, sir. Hats off to you. And
it's a great team, and team in India is doing a lot of effort. So I just wanted to share it. Thank you, ma'am.
Thank you very much. Any more reflections from the audience? All right. I think our panelists have given us enough food for thought to deliberate upon. And my sincere thanks to each one of them. We tried to have a diverse group of panelists from Indonesia, Nepal, Philippines, and Uganda. Thank you for being there. And let us join forces and work together for what we call a period-friendly world. And thanks for all of you. And we will continue this conversation. This should not end today. The discussion goes on. Thank you very much.
Thank you so much for having me.
No, thank you. Thank you, Radha ji. It was a privilege.